Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. Here, imagine having a high fever, a severe headache and body aches. Sounds like the flu, right? Or perhaps dengue or malaria. The tricky part is, it could be something much more insidious. Scrub typhus. Because its early symptoms are non-specific, it's often misdiagnosed. Today we are diving into this master disguise and why acute undifferentiated fever in endemic regions needs a specific diagnosis and prompt treatment. Who all have visited first time on this channel, please do subscribe and watch. Scrub typhus. Here we'll see what is scrub typhus. Scrub typhus is an infectious disease caused by bacteria called Orencia tsutsugamushi. That bacteria name is Orencia tsutsugamushi. And then it spreads through the bite of an infected mite, that is a small insect found in grass or bushes. And then the infection mainly affects rural or forest areas, especially during monsoon seasons. We can say this bacteria affecting in especially in monsoon seasons. Here we can see areas where it occurs. Scrub typhus is common in Asia, Pacific region, India, Japan, Thailand and Indonesia. And then in India, it is seen mostly in hilly, rural or forested areas. And then we'll see the cause and transmission. What are all the causes and then how it is going to transmit. The main cause is the bite of a mite carrying the bacteria Orencia tsutsugamushi. These mites live on rats and small animals in grassy or bushy areas. When they bite humans, the bacteria enters the body through the skin, and then it does not spread directly from person to person. Here we can see the symptoms. Symptoms usually appears 5 to 10 days after the mite bite. And then high fever with the chills is the first symptom. And then headache, muscle pain and joint pain are common in this scrub typhus. And then a black scab or sore develops at the bite site. Rash appears on the body after a few days of fever. And then swollen lymph nodes, fatigue and confusion may also occur in later stages. And then in severe cases, breathing difficulty, low BP and organ failure may occur. These are the symptoms that's about scrub typhus. Next we'll see the diagnosis. Doctor first checks clinical symptoms and presence of an scar, that is a black wound. And then blood tests are done to confirm the infection. Here IgM ELISA test detects antibodies against Orencia tsutsugamushi. And then liver and kidney function tests are also done to check complications. These are the diagnosis of scrub typhus. And next, treatment. Here especially antibiotic treatment, doxycycline, first line of drug it is. Doxycycline is the most effective antibiotic against Orencia tsutsugamushi. Next, dosage. Dosage, that is for adults 100 mg twice daily for 7 to 10 days has to be given. And then for the children above 8 years, that is 2.2 mg per kg body weight twice daily should be recommended. And then doxycycline acts by inhibiting bacterial protein synthesis and stopping bacterial growth. It's going to inhibit the bacterial growth. And then fever usually starts to decrease within 48 hours of starting doxycycline. Next, we'll see this supportive treatment, supportive management we can say. Supportive care is equally important to prevent complications and maintain organ function. Because here we can see in later stages symptoms included organ failure, that's what. And then fever management, that is paracetamol or acetaminophen is used to control fever and body ache. And then hydration, that is oral fluids or IV fluids are given to prevent dehydration. And then rest, that is complete bed rest, is advised to help the body recover faster. And then nutrition, soft, light, protein rich diet is recommended. And then here pain management, if there is severe headache or muscle pain, mild painkillers are given. It's going to work. And then recovery, most patients recover completely if treatment is started early. And then here early treatment can help. And then fever usually within 48 hours after antibiotic therapy. And then weakness may for a few weeks but improves gradually. I hope you all are clear with the topic scrub typhus. Please like, share and subscribe to our YouTube channel for more informative topics. Thank you for watching.